The 19th century marked a period of remarkable progress in the fields of pathological anatomy, microbiology, anesthesia, and antisepsis. These advancements ushered in an era where surgical procedures became significantly more humane and safer. During this time, the status of surgeons as heroic figures in the medical world was solidified. In 1902, Frederick Treves, 1853-1923, achieved renown when he successfully performed surgery on King Edward VII, who had a perforated appendix, just 2 days before the coronation. Despite the king's initial reluctance, Treves convinced him of the necessity of the operation, knowing that without it, a funeral rather than a coronation would have been the outcome. Treves was honored with a baronetcy, and this event contributed to the growth of private surgery and the wealth of elite surgeons in London. As the 19th century transitioned into the 20th century, the majority of physicians earned their livelihoods in general practice. They were either employed by friendly societies, funded by working-class individuals, or part of small, local law practices. National concerns about the population's health, especially during the Boer War, 1899-1902, exposed a significant portion of potential recruits as unfit for service. This, along with concerns about socialism and the adoption of continental models of healthcare organization, compelled the government to intervene in the nation's welfare. Under the leadership of figures like Lloyd George, subsequent welfare reforms were introduced, including school medical inspections, state pensions, and in 1911, the National Insurance Act. This legislation required contributions from employees, employers, and the state. In return, employees, excluding their families, were entitled to medical care and unemployment benefits. General practitioners were initially reluctant to become state employees, but eventually compromised by receiving payments based on the number of patients on their roster. This system covered about 1/3 of the working population, primarily manual laborers, while higher income and self-employed individuals were excluded. This arrangement allowed general practitioners to maintain their independence and supplement their income from the growing middle class. The desire for independence among physicians persisted through subsequent generations, leading to a level of mistrust and suspicion between physicians and the government bodies that paid and managed them. The national insurance healthcare system was administered through friendly societies, industrial insurance companies, and trade unions, essentially establishing a public-private partnership. While some view the National Insurance Act of 1911 as the foundation of the welfare state, it's worth noting that the elderly, women, children, and the unemployed were excluded from its benefits. Some argue that the primary aim of the Liberal government in 1911 was to sustain the workforce and bolster the empire's economy. Workers also expressed discontent with having to pay for drugs and hospital treatment, and there were concerns that employers would be less inclined to hire due to increased costs from contributions. The extension of national insurance in the 1920s expanded coverage to include widows, dependents, and orphans. During this time, workhouses were closed, and the poor law was abolished, with local governments taking over the operation of poor law hospitals. National insurance played a vital role in shaping the family physician's role in Britain as a trusted and valued member of the local community. By 1939, there were 18,000 general practitioners compared to only 2,800 hospital consultants. This contrasted with other countries, like the USA, where specialist care became dominant in the 20th century, a trend the USA is currently working to reverse.